Welcome back, everyone. In the coming weeks, many of us will be fortunate to spend some time with our families and have conversations that are mostly casual and happy. We'll talk about our children, our jobs, perhaps some sports and football. But there's a topic that we're often hesitant to bring up with loved ones, and that is living wills. How do we wish to be cared for when we're seriously ill, and who should make decisions for us when we cannot do so for ourselves? Earlier, I sat down with ABC News legal analyst Brian Buckmire and ABC News medical correspondent Dr. Darien Sutton, who can guide us through these sometimes difficult conversations. Brian, Dr. Sutton, thanks so much for joining us. So let's just start out, Dr. Sutton, with what is a living will? Yeah,
well, a living will is quite simple. It's a document, a written document that helps to spell out what your medical preferences would be in the event that you can't communicate for yourself. Linsey, this helps to guide families in the event that they're in a crisis with what that patient would want, and it helps to avoid the turmoil and the frustration that I've seen as an emergency physician when having to make these difficult decisions in a moment of crisis.
What is the age that we really should be considering, hey, I need to go out there and get a living will?
I would say once you get to a point where you're able to make your own decisions, so you could probably put around 18 or 19
oh, really?
in terms of what you should do. Yeah, it's often considered as like, I only do this when I'm really old and I'm like maybe sick or I lost someone. But no, this is something you should consider in terms of, you know what, I could pass away, something could happen. So something to contemplate, not only for yourself, but for your loved ones as well.
So we're going to be sitting around the holiday tables with our families in the next few weeks. How do you bring this up even? You know, so by the way, how's that living will going, Dad, Mom?
It can certainly feel awkward, and there's a lot of misconceptions that this is something that you only do at the end of life. But I can tell you from my personal experience as a physician in the emergency room that these conversations often happen suddenly. And so you want to make sure to pick a quiet place, a time that's not a crisis. And you want to bring it up, and you can frame it as something we all should do.
And so explain for us what a health proxy is.
So different jurisdictions will call these different things, but we'll use these terms to just help us out here. A living will is only one part of it, right? You need to have a proxy or a healthcare agent who will be, in essence, your mouthpiece for you, right? So when you're not capable of speaking, you're in a coma, incapacitated, whatever it is, this is a person that you've put in charge of executing your will, your desire, your values as to what you want. It could be in terms of what type of palliative care do you want? What type of life-sustaining care do you want? Who's gonna get the medical information to be able to make these decisions and communicate directly with the doctor and then relay that information to the family? It's also good to have alternative proxies as well, because what happens if, for example, I'm not available to make the call as to what needs to happen? My brother or uncle can be an alternative proxy, but having a primary is important.
Have you seen some really unfortunate scenarios play out when no one is there to make the decision and they don't know what the desires would be of the patient?
Unfortunately, that's the more common experience because these are not conversations that people are having often, which is why I'm so happy that we're having this conversation now. You know, in those events, when we don't know the direction to go, we often see siblings arguing. There's often disagreements between parents and children. That is expected because, again, everyone's trying their best to understand what that person would want, but when that person can't communicate, then it often leaves confusion. And when that happens, the provider, the clinician, our job is to continue the most aggressive, life-prolonging care. And Linsey, that can lead to days and weeks of discomfort that person might not have ever wanted to be in.
We mentioned that you should start getting this or thinking about it when you're 18. So does that mean it should be updated throughout your life?
Absolutely. So as you have new people added into your life, you might move to a different state. You want to make sure that you're updating and evaluating what you want. You may lose a loved one and you say, I saw what happened there. I want to make sure that what's going on with me is going to be different. Always update as your wills and your values change and the time goes on.
So I know this isn't the kind of law you practice in particular, but it sounds like you've had that hands-on experience with Mom. How did the conversations go with your family?
I think for most people, they have this difficulty of, for my parents, they're like, well, I gave birth to you. I changed your diapers. Like, it's my job to take care of you. But now I'm the attorney in the family. I'm the oldest in the family. I help with some of the bills. And now I have this legal expertise to say, Mom, no, we're talking about a situation that we've never been in before. This is a situation where I must take care of you. What is it that you want me to do?
How about for you, Dr. Sutton?
You know, it's a little different because my mother's a retired nurse. So she's been in the position that I've been in professionally, and she's seen those difficulties with families. And so she's very adamant about making sure that we understand what she would want in those moments. And Linsey, that's often what I'm asking and trying to guide families. I'm trying to remind them this is about what the patient wants.
And so what should we make sure, what's critical to make sure is included in that living will?
You know, one of the mistakes that people make is making it vague. And often you say, I don't want extreme measures. Now that can mean a variety of different things. So you want to make sure to first off, start broad, start with the quality of care that you would like. Would you like to go in the direction of comfort, where you want to make sure that the person is comfortable, or you want to go in the direction of aggressive, life prolonging care? And then on those forms, those documents that you can obtain from a local hospital or a healthcare system near you, you'll often see specific interventions. For example, CPR or cardiopulmonary resuscitation, which involves pressing on the chest. You'll often see ventilation. Do you want to be hooked up to a machine to help you breathe? In the event that you can't eat, would you like a feeding tube?
And I imagine it does extend to, do you want to be cremated? How do you want to donate your organs, for example?
Yes, absolutely.
Do these kinds of, are there variations from state to state?
Yeah, so there are variations both in terms of how they become valid documents. For example, in the state of New York, you need 2 witnesses, but you don't necessarily need a notary. Other states would require that. There's also different terminologies and how they're interpreted from state to state. And so to kind of piggyback off of what the doctor is saying as well, I'd recommend looking at some of these terminologies that we seem to feel so comfortable with, understanding what they mean in your state, and then seeing if they align with your values as well. What is life-sustaining care for you, and what do you believe it to be?
A lot of people are going to think, boy, is this going to be a big expense? Am I going to have to get a lawyer? What's the easiest, most practical way to go about getting a living will?
So I think start from here. Have the conversation. Understand what that person's values are. And then from there, as the doctor said, there are different states that have different resources, whether it be at the AG's office, where they have entire pamphlets and sometimes even have templates that you can follow. You can go to your local hospital as well. If it does get to a point, especially where there's a large family and maybe a lot of siblings who might have different values or ideas, maybe then you're going to look into getting an attorney. But a lot of these can be done with just the 2 individuals themselves or the family small unit.
Dr. Darien Sutton, Brian Buckmire, thank you both so much. What a worthwhile and necessary conversation.